don't be in a hurry to go after that, because there will be a few poster presentations. And after that, we have to wrap up and we have to issue the certificates. So by using that link that was already shared in the chat box, you will be possible to get your certificates. Even if you put the questions wrong, don't worry, we'll send you the right questions, but you have to attempt to put the questions right. Okay, and now Corinna, professor from Stanford University from United States, is presenting on future of the spine surgery and tracking devices. Corinna, please.
Okay, thank you. Can you see my slides?
Yes, all good. Please carry on.
Perfect. Well, thank you very much, Nikolai. It's a pleasure to be here, and it's a pleasure to see some Greek names and hopefully future friends as well. And I'm going to be talking about something completely different, which is our research on objective patient tracking with wearable technologies. So as many of you are aware, whenever we publish in spine surgery, for the most part, up until now, the gold standard has been us reporting using these subjective paper-based patient-reported outcome measures, or PROMs. Okay, so these are the surveys that we're all familiar with. They litter, they basically litter our literature. The ODI, Oswestry Disability Index, NDI, Neck Disability Index, SF36, PROMIS, they go on and on. And of course, in the past, they used to be given to our patients on paper-based questionnaires. And now we have developed, and we put these digitally. We can give them to our patients via email or even on an app. But the reality is that they're still very limited, okay? So these are subjective in that we are asking our patients how they say they are doing before or after spine surgery. As many of you know, about 50% of our elective spine patients who come in with chronic back or neck pain also have significant anxiety and depression. And so these can affect how our patients talk about how they're doing, okay? And so in the current, 2024 we live in, especially here in Silicon Valley, where wearable technology is everywhere, and these consumer wearables are being used all the time, Apple Watch, Fitbit, or a ring, etc. And we are tracking more and more information about how we are doing. It only makes sense that this should be the future for our specialty, where we are getting objective measures of how our patients are actually functioning after surgery. So this can either be with continuous tracking with a device, for example, like an Apple Watch, which is what we use in our study, or even smartphone-based tests. So instead of just seeing a patient for your 5 or 10 minutes clinic, seeing how they walk in, you can actually do a 6-minute walking test, for example, and that can be a better example, a better way to track how your patient is doing after surgery. So this is the background. This is why I started the Stanford Spine Track study. I began this many years ago. This is my pet, my pet project as I started here. And the idea was to improve care for spine surgery patients by tracking them objectively using the Apple Watch. So we also developed an app that is to Stanford and specific to our patients. This allows us to track the activity levels of our patients. So all of the information that you can get off of the Apple Watch, we are getting in our patients. So we eligible patients are those patients who are undergoing elective spine surgery at Stanford within our neurosurgery department across 5 different surgeons. We randomize patients 1-to-1 to an intervention to control group. So patients who are in the intervention group receive the Apple Watch, which they wore for 2 to 6 weeks preoperatively and continuously for 1 year postoperatively. And then we collected all of the health data from the Apple Watch with this study specific NeuroCoach app. And patients who were in this group, each time they came for their postoperative visits, both the patients and the surgeon would receive an objective progress report about how they're doing. And I'll show you what that looks like. For patients who were in the control group, as well as the intervention patients, they had their standard visits, which for most of our surgeons would be at approximately 6 weeks, 3 months, 6 months, and a year after surgery. And at each visit, both the control and the intervention Apple Watch patients completed the typical PROM surveys. So these include SF36, EQ5D, NDI, ODI, VAS pain, PROMIS, as well as a study-specific questionnaire. We finished enrollment on all 200 of our patients and collected all of our data. We've already done many preliminary analyses, which I'll share with you today, and future analyses are ongoing. So as many of you know, if you have an Apple Watch or an iPhone, there's a lot of data that's collected from the watch. This includes total steps, distance traveled, flights climbed, your total amount of stand time, your total amount of exercise or move time. And this is an example of a progress report that we will give to a patient who's in the Apple Watch group. So this patient had an L4 to S1 combined anterior and posterior lumbar fusion. And here we can see their results, that they're self-reported results from the including SF36, EQ5D, the ODI in this case, because this patient had lumbar surgery, and PROMIS. And we can see their scores overall improving. And so this is when they came for their 6-month visit. And so they'll see how their scores have been improving overall. And they'll also get a report to see how they've been doing objectively. So we can see that this patient has been wearing the Apple Watch on nearly all of the last 207 days for an average of 15 hours. They started off with, 7 out of 10 pain before surgery. This has been consistently and steadily decreasing over time, now more to 3 out of 10 at 6 months after surgery. We can see their daily step counts. They were at around 6,000. They decreased significantly at the time of surgery, and they have now steadily increased over 6 weeks after surgery to now plateauing out at a little bit over 10,000 average steps per day. And you can see similar trends in the number of the daily meters traveled, as well as flights climbed and standing time for this patient. And this is a fairly typical profile of patients that we'll see in terms of their walking steps and distance after surgery. In general, we see a very significant dip at the time of surgery, and then you see an increase afterwards, as one would expect. So in terms of our goals for this randomized control trial, there are many objectives, and I'm going to just go through a few of the preliminary ones and some of our first analyses that we've done, and then share with you what we're looking forward to doing in the future. So one of the things is we just want to figure out, is it feasible to actually have our patients wear this watch before and after surgery to assist with their spine care and surgical recovery? Because, they have to charge the watch every day, et cetera. Are our patients actually going to engage with this? Because if they're not wearing it and not using it routinely, then it's not going to be something that's really going to become part of care for our patients. And so we are finding that on average, patients are wearing the Apple Watch. They're wearing it for over 14 hours a day for greater than 80% of the days since enrollment. And so we're tracking this over the entire course of the 1 year. We also want to see whether patients are more satisfied with their care and whether they have a better understanding of their postoperative recovery as a result of using the Apple Watch. And so what we can see, if you look here on the left, is that for our patients, the majority of patients are either extremely satisfied or very satisfied with the use of the Apple Watch in their care. Over 50% say that it's helpful for them to see their activity tracking data at their postoperative visits. And interestingly, the surgeons are very positive in terms of near 96% either strongly agree or agree that the Apple Watch summary helps them understand how their patient is doing after surgery. So now I'll share with you some of the preliminary analyses that we've done and already published looking at our preoperative data, okay? So one of the issues is if we're going to be starting to use this objective data for our patients, we really need to understand what's normal and what's not. And as you can imagine, the number of steps that a 90-year-old woman who might be coming in for a small lumbar discectomy is taking compared to a 23-year-old Stanford athlete who's coming in for a lumbar discectomy are not going to be the same. And so in this particular sub-analysis of our baseline spine track data, we use the preoperative activity data, step counts per day, which were on average 2 to 6 weeks before surgery. And our goal was to establish daily activity measurement gold standard for patients based off of their age and sex who had lumbar disease, which was a subset of the patients in this Apple Watch cohort. We wanted to standardize these patients' activity data relative to a norm. And in this case, our reference population was was a study that was published in Lancet with a very large set of many thousands of patients. This was the MPACT study, or the Michigan Predictive Activity and Clinical Trajectories in Health study, using Apple Watch data. So similarly to how we have T-scores for osteoporosis, for example, where we can put people into different categories of osteopenia, osteoporosis, we wanted to also create similar normalized ranges for daily step counts for patients with lumbar spine disease. This is based off of 65 patients in our Apple Watch group. You can see that distribution of females, average BMI 28, Charleston comorbidity status. Most of these patients are retired. They are older, average age of 63. And you can see that the majority of these patients had degenerative disc disease requiring fusion. And you can also see their preoperative PROM scores. So what we found here, not unexpectedly, that activity and daily step count varies by age and gender, with young males having the highest step count and females greater than 65 years old having the lowest step count. We did see that the patient's activity is correlated with their PROMs. Okay, so here you can see a statistically significant correlation between the average daily step count and the ODI on the left, as well as the SF36, which is shown on the right of the screen. Similar, we did not see a significant correlation between the EQ5D, although there is a trend, and we did see a significant correlation between the activity and the PROMIS scores. So what we were able to do here is we were able to develop these new age and gender adjusted standardized Z-scores for lumbar disease patients, and to classify them into patients with severe, moderate, mild, or no impairment. So you can see that the average daily step count for a patient with no impairment is over 11,000 steps. That's shown on the bottom right of the screen. Mild impairment is a little bit over 5,000, moderate is 3,000, and those with severe impairment are doing an average of 704 steps per day. And we see that this new activity performance classification correlates well with the PROMs. You can see ODI shown here on the top left, SF36, EQ5D, and PROMIS. So then we went on and we published that, as you can see, in Neurosurgery. And then we also wanted to look at our cervical patients. So we did a very similar analysis of the baseline preoperative data in order to establish gold standard Z-scores for patients of certain age and sex with cervical disease. And this was recently published in Spine. And you can see here, this was based off of 30 patients, and you can see their basic demographics: average age of 56, 70% female, average BMI of 30. The majority of these patients are employed. 43% of these had myelopathic symptoms, 57% did not. And you can see here that these step counts differ between the cervical disease and the lumbar disease. So patients that were classified into the no impairment for cervical disease were an average of almost 10,000 steps a day, so 9,640, mild impairment at 6,000, moderate a little bit over 3,000, and severe impairment at 1,600 steps per day. And you can see the distribution here. We didn't see a significant difference between our myelopathic and our non-myelopathic patients, which is not necessarily what we would expect. I think this is likely due to the small sample size of having only 30 patients here. But we did see that these new activity performance classifications did correlate very nicely with the PROMs. So NDI, SF36 shown here, EQ5D, as well as PROMIS, and these were statistically significant. So really what this allows us now is when we see a patient who comes in with either lumbar disease or cervical disease, we're able to see how many steps they're taking, and now compared to patients of their age and gender and their disease category, we're able to know whether or not 5,000 steps is good or bad, 10,000 steps are good or bad. So that really helps us in terms of giving our patients particular goals. And the question that you may have, let's say that you're not able to give your patients, you haven't gotten a lot of funding as we do, and which was necessary for this study. And you want to do something like this. You want to know, okay, how many days do I actually need to track my patients? Do I really need to give them an Apple Watch for an entire year? Okay. Well, I don't know the answer yet for the post-op data because we are just starting those analyses. But for the pre-op data, what I can tell you is we did a study, and this has been accepted for scientific reports and will be published soon. But how many days of monitoring are needed pre-operatively? Okay. So as I said, for most of our patients, we had a minimum of 2 weeks, some had 6 weeks, and we wanted to know what's the minimum number of monitoring days that we need to reliably estimate and predict their variation and their real life physical activity data for these preoperative patients. So we were able to look at a total of 95 patients preoperatively. And what we found here is that step counts are actually relatively consistent across these preoperative days. And basically, we need a minimum of 2 days of wearable step count data. It's sufficient to estimate greater than 90% of the variance in real-time spine patients' weekly physical activity data before surgery. And if we want to estimate 14 days, so 2 weeks of their preoperative data, we need a minimum of 4 days. So in conclusion, for some of these preliminary analyses, we found the first age and sex-adjusted standard scores for real-life physical activity for patients that have degenerative lumbar and cervical disease. And keep in mind that these step counts are different between the two patient populations. Using Apple Watch step count data, we're able to stratify activity impairment into 4 activity performance groups that correlate well with their subjective PROMs. So I'm not saying that these wearables and this objective data is necessarily going to completely replace subjective PROMs, but I do think that they're a very important adjunct. And I do believe that standardization, for example, knowing how much we should tell our patients to move, this should enable clinicians and researchers to compare activity levels between patients who have lumbar or cervical disease and normal controls, compare them between individual patients who have lumbar or cervical disease and are either undergoing or recovering from surgery, and also to set physical activity treatment goals for our patients. We also see that while preoperative step counts remain relatively stable and we can do good prediction models with 2 or 4 days of data, it is important to get longer activity monitoring to account for variance in step counts over longer periods of time. And in particular, when we see a lot of fluctuations in the first few weeks or months after they're recovering from surgery. And so understanding how much activity data we actually need to make good predictions is really important because this affects study design when you think about how much data you need in order to understand how your patients are doing, and also to improve participant compliance. And so we are actively working on many future analyses. We've gotten lots of grant funding, and I'm working with some really smart statisticians and postdocs here at Stanford. Not only are we going to be looking at how feasible is it for patients to wear this Apple Watch at up to a year post-op and how satisfied are they, but we are working on doing correlations of these objective measures with subjective PROMs. We are using machine learning and recurrent neural networks in order to understand how these patients fit into different recovery profiles and clusters, and then can create even better prediction models that incorporate also objective real-time daily performance into our patients. So there's many people who've been involved in this study over many years. Very grateful to our clinic research coordinators, many members of my research lab who've published many of these papers, as well as some really important collaborators, and Stryker for research grant funding, as well as Stanford for Stanford Neurosurgery seed grant funding. So thank you very much, and I'm happy to take any questions.
Corinna, that was really interesting, and thank you so much for presenting that to us. We have to copy that in UK, so we have to continue our conversation from South Africa.
Good to see you. So much.
Yeah, thank you so much for your presentation. Thank you so much for getting up early.